Okay. Hello, everyone. Happy Monday. Happy May 10th. Really great to be here live on Facebook, on Twitter, on YouTube. Welcome to our virtual Heart and Hustle studio. This is Councilwoman Mai Bang. I just want to give a shout out to everyone. I know it is lunchtime, so if you're eating lunch and you're tuning in right now, I want to say thank you so much from the bottom of my heart for joining us today for a really awesome and special live chat today. As you know, I hold monthly live chat with community leaders throughout our city. And today, this live chat is really special to me because it's folks that we've been working closely with to bring vaccines to our community here in the heart of South Sacramento. Today, you're going to get an opportunity to meet all the incredible, amazing folks behind the scene of the vaccination clinic. And as many of you all know, we have been in this pandemic for over a year. And I have said over and over again that we know in our district, in District 8, that the inequities continues to impact our residents. And our most vulnerable community, as we all know, is still continuing to carry the brunt of the devastating impact. I represent an area with the largest cases of COVID in the city and in the county, and that's zip code 95823. And as you know, I think I hear an echo. Is there an echo? Nope. No more. Okay, I did hear an echo. As many of you know, we have been doing everything we can with all the heart and hustle to bring the vaccines to our community and meet them where they're at. It's really important to me as your councilwoman to make sure that we are truly on a road to recovery. And that means making sure that our communities reach herd immunity so that we can protect each other and our loved ones, but most importantly, be able to hug everyone and our loved ones again. So again, I welcome all of our panelists. I'm going to introduce them briefly, but want to give a shout out again to all of you. I see that you're online watching. Thank you so much for tuning in. And so, so today you are residents, or if you're not in District 8, welcome. I want to be able to introduce all of y'all to the amazing folks that makes our South Sacramento vaccination clinic at Pannell a reality. And they're really the support team behind the scene. As I always say, no one entity ever does anything alone. I'm so grateful to our 15 plus community partners, our churches, our CBOs, our hundreds of volunteers that show up every Friday to make sure that our clinic runs smoothly. But today's conversation is really going to be with some key entities and individuals that we know this clinic would not be possible without them. And so I have the honor of bringing them onto the virtual stage. They've been sitting here listening to me talk. So I'm going to introduce them briefly, and we're going to go, and I'm just going to ask them questions and want an opportunity for all of you to meet them. So I'm going to run through this really quick, but I wanted to let you know we have Daniel Bowers, Office of Emergency Management here from the city of Sacramento. Daniel, wave your hand. Awesome. We have Myrtle Sadani, and I know I didn't say it correctly, so he's going to be able to correct me on that, but he's from IT from the city of Sacramento. Katie Hauser from YPSI. YPSI stands for Youth, Parks, and Community Enrichment for our city. Steve Johnson, who is the main person now that runs the facility there. He's also from YPSI, and he's here today. The vaccine magician, as I call him, Dr. Rusty Oshida from Urgent Care Now, and Matt Clemens from Equifax. And you're going to get to learn a little bit about the amazing work that MAC is doing to make sure that we get folks register and really helping with a lot of the back end logistics. So with that, I'm so excited. Thank you, all of you, for being on today and using your lunchtime when you could be eating lunch right now, but you're here in virtual space. I'm so grateful to have you all on. So first, I'm going to ask and direct some questions. Dr. Oshida and MAC, thank you for being here today. And I'm going to ask the first question to you, and this one is for Dr. Oshida. Dr. Oshida, I know that you and your team were one of the very first medical teams to step up, vaccinate tens of thousands of Sacramento residents all over our city and our county at community clinics, including our Pannell Center. I want you to be able to tell us a little bit about yourself and what inspired you to do this.
Oh boy, that's a complicated question. So a little bit about myself. I guess myself professionally, I'm an emergency physician. I own Urgent Care Now, which are two clinics in Sacramento. And I'm also a clinical researcher with Benchmark Research. And when I think about where we are today, and today, by the end of this week, our clinics will have vaccinated 100,000 doses. At the end of this week, we'll have done 100,000 doses here in Sacramento. And I think about how do we get to that point? And really to get to that point, I've been very blessed to be at this focal point of this trifecta between emergency physician, practicing emergency physician, Urgent Care Now owner, and researcher. And when I think back the early days of COVID were terrible, to be very frank with you. These are dark, scary days, literally, figuratively. I can recall so many times driving into emergency medicine shift, 4:30 in the morning. It's pitch black outside, no cars on the freeway. It's apocalyptic. You're trying to listen to the radio and podcasts, soak in as much information as you can. What's going to happen when I go to work? Am I going to get COVID? Am I going to get sick and die? Will I come home with COVID, give it to my family? Will they get sick and die? And it's scary. And it's quite frankly, it's shackling. It bound us in a number of ways. We've seen that in the clinics. We've heard a number of patients say, I have been homebound, bed bound. I've been afraid to go outside, afraid to unwrap groceries, etc., for the past year and a half. So the question very early is, what do you do about that? And again, this fortunate interplay, if you will, my emergency medicine shifts are at a hospital up in Fairfield and Vaca Valley. We were the first hospital in the entire country to diagnose community-acquired COVID. So this means this was not a direct exposure to any one geographic area in the world, but this is the first time where degrees of separation led to that disease. It was the time where, quite frankly, in medicine, we say the barn doors are open and everything is now free for all. But what this allowed us and me personally to have was interaction with the CDC, California Department of Public Health, Solano Public Health. And we learned about the epidemiology. We learned how to diagnose. We learned how to treat COVID very, very early in this process. Emergency medicine, we have these tenets of just figure things out, find solutions, not problems. And we then started to employ that in our clinics. And that was sort of the next phase. We started very, very early testing for COVID, not only the nasal swabs of PCR and antigen and learning those, because quite frankly, we didn't know what those were before, but then we started learning serology testing. We then applied that into a large scale. So while I talk about myself as an emergency physician, as a clinic owner, as a researcher, I really need to talk about myself as a person. And my person is, I'm also a father. I have two kids. They're fantastic. Our son, Sam, is a senior in high school. My daughter, Lauren, is in 8th grade. And early on, I was concerned that Sam may never see school again. So I had a fortunate opportunity to work with this high school and the Safe Return Task Force to start testing en masse. We test 1,000 students, faculty, and staff every single day in 2.5 hours before they step foot on campus. And what this has allowed to happen is his school has opened, stayed open without disruption, and has increased from 2 days a week to 5 days a week. What's all this have to do with testing in the Pannell Center? Well, what it led to was flow processes. We then said, hey, can we employ this testing and flow process somewhere else? And then when that third piece came around, which was the research piece, we saw very early as I was doing research with Moderna and the phase 3 clinical trials that they were going to submit for an EUA, an emergency use authorization. And when this started to come out, our office manager extraordinaire, Kim Luna, had submitted last August an application so we could administer vaccine. I had no idea, quite frankly, how to administer vaccines. So now I need to draw in some more help and some more resources. And Nav Kuhner, who runs Benchmark Research, said, Dr. Oshita, let me show you what to do. So between the two, Kim Luna and Nav Kuhner, we've developed a team and a system, and we employed those flow processes at Jesuit. And there we were able to vaccinate 10,000 Sacramento residents. And we hit yet another amazing individual, Matt Clemens, who's on this call. And Matt said, Dr. Oshita, I love what you do. And you do the medicine part really well. Kim Luna does her part really well. Nav Kuhner does her part really well. but there's some parts that I need to spiff up on you. And Mac has just been an absolute amazing individual to work with, and we're so blessed. But the three of these elements all sort of converged to delivering 10,000 vaccines in this first community in a very, very efficient manner. We've been able to then teach Natomas Unified School District, Folsom Cordova Unified School District, Dignity Health System, Consumas Fire, and continue on now and expand to other clinics. And Councilmember Vang said, hey, you know what? We need this similar processes in our South Sac community because, again, like you heard her say, this has been such a hard hit area. It's been an area that needs to have these flow processes. And we've been so blessed to be able to be down there with all the help from her team who have just been amazing. Kat, Ryan, your whole team have just been amazing. And so hopefully one of the things that we can learn today is that these first, while exciting and neat and what have you, they were not without challenges. And personally, it was very difficult for me to take some of these challenges on the chin, but we did. And Mac hit some challenges and we took those on the chin. And here we are now, many clinics passed with a lot of help from our community resources at Pannell, our OES services that are here, our IT folks that come every single week, and then most important, all of our volunteers. And even though we took a couple of wallops on the chin there, I tell you, it's all of the help of our volunteers, their excitement, their enthusiasm, the amazing stories from our patients talking about how this yoke is now off and they're able to live and have somewhat meaningful lives again and hug their grandkids. And it's just powerful, very, very touching for us. So sorry for the long-winded story, but it's a bit complicated how we all got here, but also very, very awe-inspiring. And it is, like I say, all things in life are intertwined together. And in these aspects are all intertwined here for me personally.
Thanks, Dr. Oshita. Thank you so much for sharing your story with us and how it kind of really began. And I really appreciate this, you kind of bringing us along and sharing how you got involved and inspired to do this very important and critical work, right? When we're talking about the road to recovery, it really means vaccination, making sure that we can protect our loved ones. This next question is to Mac, and Dr. Oshita shared a little bit entry of how Mac entered the space. But Mac, I know that you own a successful website design company that's actually not associated with vaccination clinics at all. Could you tell us, and I think Dr. Oshita shared a little bit, how you became involved and your role at community clinics and why you developed Equifax. And I asked this question in particular because I will always be a champion for District 8. And Dr. Oshita, I will share with you, when the vaccines were rolling out and I saw that other regions were getting in, I think it's so great for your leadership. I was also taken back because I wanted to make sure we get those vaccines to our community, especially in the zip code hardest hit. And so I'm just so grateful for Max's work on the back end, on the registration and logistics, and want Max to talk a little bit about Equifax and how he became really involved in all the community clinics now that I'm seeing throughout the city, not just the one at Pannell, but throughout. So.
Well, yeah, I mean, thank you so much. And thank you for being here. I'm really humbled to be with such a group of really active and compassionate people that are working on this important cause. I first met Dr. Oshita at Jesuit, and I had the privilege of volunteering there, and I was really touched by how lives were so changed by, just the vaccination process. I was like, wow, we really are giving life back. And, just personally, I'm an extrovert and I really missed people. And I think my partner was, getting driven crazy by me wanting to go out and have fun, and there's just nothing to do. So this is really an opportunity to return that normalcy of life. And so I worked with Dr. Oshita at Jesuit, and I was really impressed with the process. And so I was speaking with another friend, Ann Hardy, who's also volunteering there. And we said, how can we bring this back to other parts of the community? How can we, address vaccine equity? And we were really taken by this article that was in the New York Times that really said, even in the neighborhoods that need it most, it is people with access to iPads and easy scheduling apps that are taking all the appointments. And, what do we do about that? And of course, it's human nature to, leverage privilege to get things, but how, the people that needed the help the most were not getting the shots. And so we needed to address that problem. And so the county got on board. Dr. Ishida said, let's make this happen. Let's see what we can do. And then we found out about Pannell. And so, Councilmember Vang, I learned from you in watching how you and your office, the Heart and Hustle team, went out and worked with community-based organizations to do the registration. We started talking to a lot of folks like Chet Hewitt, who's very instrumental in talking about how with the Black Child Legacy campaign, how to reach out, how to make sure that the irony is that we built a website, Equivax. We needed a brand to unite everybody, to make it clearer, because it's very confusing when people are going to make an appointment. Do you go to My Turn? Do you go to the county? Do you go to the city? Do you go to Pannell Center? Like, we needed a really clear brand that would be the conduit for all of the communications, the registration, the reporting. And then talking with, Dr. Ishida and Kevin Mackey and some of the other physicians, Kevin Mackey was talking to me because, you guys would love to help, and see all these boxes behind me. These are all the forms I have to get uploaded into the state database. And so here you had these incredible physicians, talented, ready to do the work, being crushed by paperwork and state requirements and the counties. And so, so Equivax is just it's basically the goal of it is just to see to put into action what would be true if technology and like operation strategy were not an issue. If everybody had it all work, then what would we have? And that's like what I feel like we now have attained at Pannell. And this is not just thanks to my work with the site, but this is thanks to City of Sacramento IT providing all the computers on very short notice, Office of Emergency Management, Daniel Bowers and his amazing team who show up with cones, support, traffic, it's RT buses running on a regular cadence. It's everybody working together to make these feel like a really first-class experience. And what I think I'm most proud of in all of the work that our team has done is just making sure that we have consents translated into all 12 languages. Like Dr. Ishida was awesome and said, yes, here's the consent form, like, go ahead, let's translate it. Let's go ahead and add fields for registration desk and, and other things. And so from then, it's just the joy of like running a clinic really efficiently and creating an open source pop-up model that we can use for any other clinic that wants to do it. Because I don't want anybody to have the experience that I had with Dr. Ishida trying to run that first clinic at Pannell, where it's so stressful and there's so many things going on. We want to make sure that it's, running vaccine clinics is hard and it's hard to do it safely. You have to do it safely. You have to figure out, what do you do with appointments versus walk-ups? What do you do when somebody's undocumented? What do you do if somebody doesn't have insurance? Absolutely. And yet creating that compassionate experience for every single person in the community. So even though they may have felt like they're at the back of the line with everything else in society, they feel like they're in the front of the line and getting a first-class experience in their own community center. That's so important to us. And that's so important with you too, Councilmember Vang, because we worked with a lot of elected leaders, but you're the one there sweeping the floors at the end of the day, making sure that this really works. So I just want to give a big shout out to everybody on this call for making it happen.
Thanks, Mac. I actually have a question for you. And you mentioned the clinic model, right? And I remember the first time on March 12th, when we first held our first, it was very chaotic, but we ironed it out during that first time. And each week it's changed. And so I know that you and Dr. Ishida have changed your clinic model a few times over the past 9 weeks, and we're entering week 10. Why was it important for you to keep refining our clinic model? Because I know it kept changing each time, and would love you to share a little bit about that.
Yeah, so the first model that we had, we served 760 patients and served 760 doses that first fateful day on March 12th. And I remember being like, oh, okay, we're going to run this. And Dr. Ishida, I think I said something like, I think we bit off more than we can chew, but we're still chewing. He goes, giving that Mike Tyson analogy, like, want to learn how to box, like, go take some punches, and and it was really just the first 2 hours, and everything smoothed out right before like the press and the mayor and everybody showed up. It was fateful, but we had like people outside doing vaccination on the basketball court. We had a drive-through that was doing its thing. We had the inside, and we were all just sort of working through it. But to really dial in the quality, to make sure the reporting is accurate, you need to log who did the injection, what arm, all of this important stuff. You need to make sure you're vaccinating people not with the wrong vaccine. You have to make sure you're giving the right dosage. And so we needed to really tighten up the operation. And we barely did that 760 by the skin of our teeth. And yet, a month later, we did with multiple doses, first and second dose, Moderna and Pfizer. We did 2,600 in one day. And it was a snooze. Like, it was no problem. It was so orderly. So every time we improve it, we had to keep improving it in order to increase our capacity. Because that's the problem, is you get people that you have all these well-intentioned people and you have hundreds of volunteers, and then you can only do a few hundred vaccines. And that's been typical of every major big mass vaccine site. It's always like pandemonium till the muscle memory builds and they get the hang of it. Mm-hmm. But also, if you have these big mass vac sites, people don't feel welcome. So you need the ability to pop them up in new places. So we built a model that was reusable. So anybody that volunteered at one clinic would know how all the other ones work, so they could travel with us. Mm-hmm. And I think we really knew we had something when we went to Robertson and we did 1,000 the first day, and it was smooth. Mm-hmm. And the internet went out and it still worked because we had the backups and we had the other things. And so that, I think, is the accomplishment, is being able to go to Liberty Towers and on the first day do a bunch, go to Galt, serve the farmer market community, do a bunch. And like, they always have that really consistent, great experience, because, we can all try to do the right thing, but it's going to come down to operations and logistics to get it done safely.
Absolutely. Thanks, Mac. I know it's a super oiled machine now and everything's so smooth. And when I hear from the residents that come in, they always say, this is definitely like first-class service, right? At the heart of Pannell, at the heart of Metaview. And I think a big part of it has to do with just the model design and the great work that you put in to make sure that it's as smooth as possible. I have one more question for Dr. Oshita, and then I'm going to transition to our incredible city staff, our city team. So Dr. Oshita, I want to ask you this. We've been at this, at the Pannell, we're entering week 10 now, and we have vaccinated thousands of folks in South Sacramento. But I want to ask you this question. Why is this so important for our communities to get vaccinated now instead of waiting? For those that are still waiting and saying, hey, I'm not sure, I'm just going to, sit back and watch. I want to ask you as a doctor, why is it so important for our communities to get vaccinated now instead of waiting?
Yeah, well, I think if we look at current data, so correlative analysis here, the state has an approximate 4% positivity rate, and approximately 60% across of California residents across the state have been vaccinated with at least a single dose of vaccine. We compare that to Sacramento County. Sacramento is still in this red tier with about an 8% positivity rate. But Sacramento is only at about 30% of a first dose. Mm-hmm. And so while we can't draw an exact analogy between those two in terms of research and what have you, you can certainly make some inferences there. And so one of the inferences, of course, is, gee whiz, are the vaccines working? And most people would say yes. We know that Pfizer has delivered approximately 300 million vaccines across the world and has an excellent safety and efficacy profile right now. And so that's going to be very, very important. We know that Moderna has released recently that their second booster, if you will, or second dose in this booster is going to be highly efficacious against the strains that have been out there. So number one, we need to start helping our communities get safe here now. And we also need to help our communities be safe tomorrow and in the future. From a medical perspective, I have said, especially from an ER perspective, I am highly concerned if we drag this on too long, strains, mutations can have dramatic changes. And one of the dramatic changes that I am highly afraid of is if there is a pediatric strain. Thus far, pediatrics and adolescents haven't escaped COVID-19, but the intensities of morbidity and mortality we have not seen in as great of numbers as we have the adult community. So we definitely need, in a very vigorous and a very vigilant manner, to get as many folks vaccinated as possible to get to that herd immunity that you talk about and to avoid a dangerous, scary strain or mutation.
Thanks, Dr. Oshita. And I know that, working closely with SAVE, and I want to give a shout out to SAVE, which is Sacramento Alliance for Vaccine Equity, which is our collaborative with our churches and CBOs, is that, it's definitely, we're going to have to change the strategy in terms of outreach, right? Not just social media, but the one-on-one is going to make the huge difference. And not just bring the vaccine to the community at Pannell, but literally, like, how do we get it to their homes, right? Which is kind of the next conversation that's going to happen. But I want to say thank you so much for emphasizing that, because I think there are individuals out there that are just waiting, and it's so important to hear from you as a physician why it's so important for our communities to be vaccinated now instead of waiting. So just thank you so much for that. So I'm going to transition, and I want to have a conversation really quick and ask our city staff. They're still on, so that's great. Thank you so much for your patience. If you're watching this now live on Facebook, Twitter, YouTube, thank you so much for tuning in. Today is our live and lively conversation on social media. And really, I want you all to meet the heroes behind the scene, the folks that are helping to make our people-powered vaccination clinic a reality. So with that, I want to give a shout out to I want to give a quick shout out again to our city staff. We can't do this without the city of Sacramento. And we have some key folks on this virtual panel today to share a little bit about the work that they've been doing. Next, I want to introduce Katie Hauser and Steve Johnson from our Youth and Parks and Community Enrichment Department. My next question is for Katie. So Katie, when we started our clinics at the Pannell Center, you mentioned that residents would regularly go to the community center to inquire about the availability of the vaccine. And I think this is really powerful because it's truly a testament to how much our communities actually depend on the Sam and Bonnie Pannell Community Center. Could you share with us more about how you see the role of Pannell and our city's community centers, especially during this pandemic?
Absolutely. Well, thank you for having us on this call, first of all. And I think that connection is really a testament to how amazing our staff is in the field at all of our community centers. They're so in tune with the needs of their neighborhoods. And Youth, Parks, and Community Enrichment is another name for Parks and Recreation. That's really the essential services that we provide. And we have seen through all of this really how essential Parks and Recreation are, right? When they told you couldn't go out in public and everything was closed, you could still go to your neighborhood park, right? And you were encouraged to do that. So the community centers are also built the same way, right? They're meant to create safe spaces and services. And we typically do that through a recreation lens. Of course, March 2020 came and we shut the community centers down as we kind of knew them. But instead of through recreational services, we really flipped to emergency services. And we were doing curbside meal distribution, where Steve and his crew were out every single day doing meal distribution for youth 18 and under, and doing 300 plus meals a day that they were handing out curbside. That will continue again this summer. We're going to reboot that starting June 28th. That service will continue to be available again. We did mask distribution. We gave out over 300,000 masks community center wide over that time frame. We did essential worker childcare. So essentially, we shut the programs down as we sort of knew them, but we're able to flip those spaces over, use our amazing staff who are so in tune with what's going on with the needs of our neighborhoods. We had seniors that were calling the front desks saying, I'm afraid to leave my home, but I need food. I'm running out of food. Where is a food bank? We had staff that would literally go out to food banks, wait in line, and deliver the food to front porches of our seniors, did wellness calls, sent cards, really did the best that they could to stay in touch with our community and our neighbors, so that we really just continue to understand that we're still providing safe spaces, we're still providing city services, but just in a little bit of a different way right now. So I think this really has shown how essential our community centers are, and how essential Pannell is to our neighborhood in District 8. Especially as with the vaccine clinics, we can really see this just is another way that we're able to provide those emergency services at the same time that we have program there, right? In one portion of the building, we have it kind of roped off for vaccines. And then the other portion, our colleagues in the youth division are running SAT class, which is a distance learning support for parents who cannot stay home with their children who have distance learning. So, and those are just happening, at the same time. And that's just one example of how we're able to really utilize that city space and that city resource to serve our neighborhood. So it's just, again, a huge shout out to the staff at Pannell and the team there. They do a fantastic job. They're in touch with families, with youth, with seniors on a daily basis there. So I think it's a really important role, and one that we're really, really happy to serve.
Thanks, Katie. And I just want to say thank you so much for your leadership, because everyone at Pannell and even you and Yipsy, I mean, y'all have been incredible, super flexible, nimble, doing everything you can to make this a reality, right? And I'm just so grateful to the city staff and the city for really stepping up in this moment to say, hey, we need to do this now. And we're going to use our community center because that's what it embodies, right? It's really the hub of the community. And it's, I mean, I've been able to see the magic that has happened at Pannell. And a big part of that is because of the leadership of you and everyone at Yipsy. So I just want to say thank you so much for your heart and your hustle. My next question is for Steve. Steve, you are the site supervisor at Pannell. Could you share with us a little bit more about the programs, at Pannell and what they offer that can really foster trust within the communities? That's the first question. And the second question I had for you is, as site supervisor, why is it important to host these clinics here?
Sure, thank you, Council Member. Yeah, the Community Center at Pannell, we offer a variety of programs for the youth to the seniors. Actually, we try to strive to meet the needs of the community by creating safe places and where staff are building these one-on-one relationships that establish that trust. The center also provides many opportunities for the residents to, as of our wellness rooms, our exercise classes, ceramics, after-school programs, and so on. We really like the participants to interact with each other. And why is it so important for Pannell to host these clinics? Is that these same faces that we build relationships with, they think of the center as a safe haven and the hub of the community, which makes the Salmon Bonnie Pannell Community Center a perfect place to host these clinics.
Thanks, Steve. And just thank you so much because I've been over the past 10 weeks, because I'm there every Friday hustling, I've had an opportunity really to work side by side with your staff at Pannell. Everything from putting chairs away to just, and they're always saying, Councilwoman, do you need anything, right? They're amazing. I mean, it definitely feels like a family there. And I would say so even when I talk to the residents that come in to get their vaccination shots, they tell us that it is just so welcoming at the Pannell. And I think a big part of that has to do with our incredible staff and also your leadership too, Steve. So I just want to say thank you so much for everything that you do there at the Pannell Community Center. So next, I want to transition to IT. And next, I want to speak to Myrtle, and I want to make sure he says his name so that I'm saying it correctly. But I want to give a shout out to IT because they have been so incredibly helpful, not with just providing tablets and laptops for each of our community clinics so that we could do all the registration and upload, but they also reached out to our team to propose a text line that is able to communicate with residents in multiple languages. And so I want to ask Myrtle this. Can you share more about why you proposed this and how this method can be used for other city services in the future? When my team shared this with me during our weekly meetings, Ryan and Kat has shared that we were going to have a text line through the city, right? Once folks register, we can do reminders and say, hey, District 8, would you be down to do a pilot program? And my team was like, yeah, let's do it. But I just thought it was so awesome that IT reached out to us saying, hey, let's try this out. Would love you to speak a little bit about it and how this method can actually be used for other city services in the future.
Okay. First of all, thank you for inviting me. Usually IT folks always work behind the scene. So we don't like to come in front and start talking about what we do. We actually ask people to speak about our work, not by ourselves, right? So first of all, thank you for that. So to be clear, my name is Mridul Sadanandan. So if you make a mistake, that's completely okay. It takes a little longer to get practice. It's that rolling tongue thing. So see, one of the biggest benefit I see always with IT folks is they get to see a problem in a whole different level. So they get to see from when we talk to a department or a division, they look at from their vertical. They look at, hey, I have this one problem and I want to solve it. And as a technologist, we get to hear this from different departments, different groups, and we are able to actually hear that story and say, okay, how do I solve a problem using technology? Then come back and say, if I hear a similar concern or complaint from a different department, we are like, okay, I did this before with somebody else. I'm easily can duplicate the same thing, tweak it a little bit, and apply it somewhere else. So that was the beauty of being in the technology area. So we see patterns within the organization. In the case of city side, city been investing in this concept called smart city for a while now, talking about how do I modernize customer experience better. City and council been heavily invested in that kind of technology for recently. We modernized recently our 311 application. How do we communicate with citizen? How do we keep a customer a 360 view? How to make sure that they are able to know what is happening in their neighborhood. So we've been investing in that technology. So we started looking at, like, say, things like artificial intelligence. How do I, instead of being reactive, how do we be proactive? So if there is something happening in the neighborhood, instead of the citizen coming to us and saying, hey, there is a problem in my neighborhood, how do we let them know there is a problem in the neighborhood? Mm-hmm. So that they don't have to like call the same 311 line from the same neighborhood 5 people. So we are able to actually start looking into that kind of technology. And we were looking at all that, a chat bot kind of technologies for it. Then when we were talking about vaccination, and there was like tablet being issued in this for the vaccination Pannell, then we were talking with Daniel Brau's group about it. They're like, maybe I saw an opportunity pretty much at that point, and say that maybe we can do a little more than what just delivering a tablet and just getting the record in place. That maybe they're looking for this kind of technology, and started the conversation. So this was like, I was like, this is what we call as a proof of concept. And it's been really successful. Like some of the numbers we were looking at was like, we sent out like 16,000 text messages in multi-language. We were able to figure out, is it a cell phone number or is it a landline? If it is a landline, text message is not going to work. So we said, oh, maybe we should figure out how to leave a voice message on the line instead of a text line. So the technology was supporting this. These are all like technologies used by like Amazons and big, giant, national, international level organizations. So we were like, okay, let's take this technology and try to implement it in the city. So, and beyond all that, we had people from the community just in the District 800 plus people signed up for waiting list. In their own language. So it's like, that is like taking, like they are being proactive and able to provide that information from the beginning.
Yeah.
And where do I see this going? We already have some interest internally from actually Parks Department, the Youth and Parks Department. They wanted to use that similar technology with our youth, because that is the texting, the Instagram, Facebook is the choice of the youth. So they wanted to, that department is looking at possibly how do we recruit youth for summer? How do we engage with them, having a conversation of recruitment for the summer programs? So we are working with that department. We are working with fire for inspection about reminders going out. If fire inspections are going out, how do we remind them that there is going to be an inspection tomorrow? Somebody's going to show up at your the shop tomorrow. And so we are going to expand into that artificial intelligence, natural language, like having, instead of calling and the robotic answer, how do we do natural language in their own language? So we are looking at all that as the future for going to use all this technology.
Yeah, no, that's so awesome. I think the fact that we not just have a text line, but that we can actually communicate with residents in multiple languages as a government entity is pretty powerful stuff. And I'm just so grateful to IT and that you saw an opportunity to say, hey, let's collaborate. Let's have a text line, and let's also make sure that we can do it in multiple languages. And so if you did text our line, and let us know your preferred language, you would get a reminder in that preferred language of your appointment. And so again, just really thank you to you for your leadership, Myrtle from IT, because again, we can't do this alone. It wasn't just providing the laptops and the tablets, although I will say on March 12th, I remember the Wi-Fi wasn't that great. And so we had different departments, OEM folks there to make sure that we had everything ready to go. And so again, I just want to say thank you. And I actually am really excited for the city of Sacramento and knowing that it's going to be utilized for other city services in the future. So I want to say thank you to that. Lastly, but certainly not least, I want to introduce Daniel Bowers. He was the first person I introduced, and he's the last person I'm asking a question to. And he is our Director of Office of Emergency Management. Daniel has been amazing during this time. I mean, Daniel, you are hella heart and hella hustle. And we cannot do this without you. And I want to say thank you. I know that your office has literally been on the front line of this pandemic as a response from our city since the onset. And now you're on the other side and helping to keep our community safe while they're trying to get vaccinated at the Pannell Center. I want to ask you really just given your experience and your time and everything that you've done over the past 10 weeks, or we're coming into the 10th week, what are some of your reflections that you have about this pandemic from your perspective as director of OEM and also watching our residents get vaccinated? What have been your reflections over this past year? I wouldn't even say the past 9 weeks, right? Since we've entered this pandemic, you and your office have been on the front line. I would love you to share a little bit about that.
Yeah, thank you, council member. And first, thank you so much for having myself here. And obviously, as the group has indicated, just an extremely proud opportunity to be part of this, bringing the vaccine down to the community level, partnering with everybody. It's a very unique and in my eyes, joyful experience when you get to bring together the council member, the elected leader of that area, the community-based organizations that really drive and participate with the basis for our elected authority here in the city. And then you also get to combine with the private partnership from Dr. Oshida, who's just been, I don't know when that guy sleeps or if he does, but he's just everywhere at all times. And then also with the city staff, the operational staff, bringing together all those teams combining for a very beneficial product to the community. So I've just been very proud of that. But that is a heck of a question, council member, over the past, year and a half, really, that we've been monitoring this. And I really started monitoring COVID-19 in earnest back in, I'd say early to mid-January of 2020. And I was actually on Marine Corps Reservists as well. So city is very supportive of Marine service. And I remember standing in the airport to head to my service duty station in January of 2020, and I was monitoring a couple articles about the potential virus coming out of at that point still fairly consolidated to China and some of the Asian area over there, but they're starting to talk about potential spread. And I remember being in the airport, and there's so many people just exhibiting cold and flu-like symptoms and coughing and different things, and I just got this feeling that it was something impending. And I remember that was when we first really started sending kind of notifications out to city operations and starting to kind of gear up for it. And we started just really expanding our thought of how it may impact us, what we might need to be doing to prepare for this. And I ended up hiring right around that time a staff member who you all know on everybody here, Janelle, who's just been a phenomenal logistics chief throughout this entire pandemic for me. But I stole her from Cal OES Logistics, brought her in, and from her own work ethic and the relationships that she's built, that was probably like the hire of the century for me. So it's been great, but it's just been kind of nonstop. And we game planned so often about preparing the city, preparing the communities, how we can best serve. A lot of our ordering preemptively ahead of a lot of the supply shortfalls. So we were well stocked with sanitizers, with soap, disinfectants, things like that. And then, of course, obviously masks. And this may not be widely known, but for a short time, we were supplying a lot of the hospitals with N95 masks because of the own city stock that we were well supplied on. And I don't know if there's a municipality across the country that had almost 200,000 N95 masks prepped and ready to go for everything from particulate wildfire smoke to a potential pandemic, but we did, and we had that, and we weren't selfish with them. We got them out throughout the community to those who needed them most. Dr. Oshida, their peers, first responders, we were handing them out to everybody who needed them, getting to hospitals as far north as Reading. At one point, we were getting them out to all of the first responders, not just city of Sacramento, but down to Elk Grove, their law enforcement, also our Sacramento Sheriff partners. So was a team effort. It was a unified community approach to this, and we were getting those resources into the hands that needed them. You know, from a operational standpoint, the best thing that I can do is put myself at points of friction with our community stakeholders and give them the resources that they need to do their job. You know, I'm not the doctor that's administering the vaccine, that's Dr. Oshita, but making sure that he has everything he needs, that's my job. I'm not the person that's handing out food at the community centers, but making sure that they have everything that they need to do so safely, that's my job. Getting them the masks that are then, you know, supplied at those community centers that are then given out to the community, that's my job. So it is a intense team effort here, and I take a lot of pride in I would say the work ethic there to make sure that I'm not letting them down and that they have everything they need. It's the most important part of this. And for the IT folks, and he kind of touched on it. He's so much behind the scenes, but I'll brag about them for a moment here, as because they were such wonderful partners beginning really back in 2018 when I brought to them a concept that we used in the Marine Corps about really displaced operations with being able to have integrated communications. And what I mean by that is, so often I would be in video teleconferencing where I'd be briefing my subordinate leaders. As a captain in the Marine Corps, I'd be talking to my folks who are in different countries, talking about training and operations that were going on there. And we could have face-to-face conversation. We could do live chat logs and so forth. And I wanted something that if we had a major, honestly, it was driven by a major flood here in Sacramento, where that's a primary natural hazard. I wanted something that if we had a major flood and we had to do displaced operations, I wanted to be able to talk to my department operations centers and make sure that they had everything that needed from a resource standpoint. We could communicate well. Well, our IT folks embraced that and met the challenge. And about a year before the pandemic hit, they started fielding Microsoft Teams at PCC. And so when we had to move into basically the shutdown, and we had folks moving to telework and so forth, IT had already met the threat. I mean, we basically just, stopped going to an office and turned on Microsoft Teams, and operations continued near flawlessly. And I can't commend them enough for that effort and being so prepared. And the community should understand that you have folks, not just like IT, but across the departments, that are so well prepared to respond. And Katie mentioned this and kind of touched on it, but she did gloss over it a little bit. And I could probably talk all day long about the accolades that YPC deserves from this pandemic, because when so much stuff shut down, so much still had to go on. Rusty Oshita's staff still had to go to work because they're frontline medical workers. Police and fire still need to show up. And a lot of them have children. And while we can thank our gracious that this wasn't particularly harmful for pediatrics, those children still need to get looked after. And so when the schools shut down, what did? We leaned on our community centers to essential service childcare worker locations as well. And so just that whole community concept that we came together across all the departments to A, continue operations, but then B, be that huge backstop for the community to rely on to get resources, watch children, everything. It was a heck of a year, and to kind of bring this full circle, being out at the vaccine clinics and seeing the most at-risk folks, the elderly, the people with underlying medical conditions, the people who are most susceptible to this effect, to see them get their vaccinations, and to see those stewards from council member, your office, and the community organizations walk along the line and make sure that those elderly folks who come up, that have walkers and canes, get ushered right in very quickly, and they're not having to wait. It's a wonderful sight, and I've stood there a few times. I think you and I both have, council member. We've talked and we've reflected on this, and it's a great experience to see the vaccine clinics do their purpose. It's to kind of go full circle from where we began, and just like Dr. Oshita said, we cannot get complacent and let down our guard. We've got to remain vigilant, because there are strains that are out there that are going to do some weird stuff. 100%. You're seeing it in India. You're seeing it in Brazil. We saw it earlier, a few months ago or a couple months ago in places like New Jersey and Michigan. Different strains can throw us some curveballs. So getting that vaccine out there to the folks who need it, it's very important, and I'm proud to be part of it. So hope I answered your question. It's kind of where.
So awesome, Daniel. as I was listening to you, I was just thinking about when we first launched this vaccination clinic. I really, it makes me so proud to be a councilwoman of a city that has pretty much put down all walls and barriers to make sure that we meet, the needs of our most vulnerable community. I'm just so grateful to you, Daniel, for your leadership, your flexibility, being so nimble. And you said it best, right? Like you said, my job is to make sure that everyone else is resourced so they can do what they need to do, right? And this Live Chat is about the heroes and the folks behind the scene, right? And I am just so grateful to you, to Dr. Oshita, to Steve, to Myrtle, to Katie, to Mac, to everyone who came together to make sure that we made this clinic a reality for our families and our communities. And I can't say that enough. I'm just so grateful. And I know the community is, our elders, residents in our neighborhood is just so grateful that Pannell truly became the vaccination clinic for the heart of South Sacramento. And a big part of that is because of all of you. And, as I'm getting calls throughout the state and folks want to know, how are you all doing it? I'm going to be directing them to all of you because you know exactly what's happening, right? Everyone has a role to play in this vaccination clinic, and it wouldn't be possible without all of you. So I know we're coming close to an end, and I'm just, so inspired by all of you and the work that you all do. I have one more question to ask you, and I think you hear some noise in the background. So if you're not speaking, if you can mute really quick, just in case. Awesome. I wanted to go around and just ask you one more question before we get off the Heart and Hustle studio. Is what is your hope for our Sacramento residents post-pandemic? I'm just going to pause really quick and let you reflect on that, and then we'll go around. What is your hope for our Sacramento residents post-pandemic? And I'll go the other way. I'll start with Daniel Bowers, and then we'll go backwards how we started. So Daniel.
Well, thank you, Councilmember, and great question. I think one of the most important things that we need to remember is kind of how I closed off that previous answer is remain vigilant, but hopeful that the vaccine is going to take its role in mitigating COVID-19. I think we've seen it locally with some of the strains, some of the resiliency that the vaccine has had against different strains, especially for our elderly and folks with underlying medical conditions. And we see that it's indicative of the good occupancy that we remain to see as we get that distribution of the vaccine out across our ICUs and so forth. But I would say for folks, as they do get out there and they start enjoying time with their family, much deserved, absolutely. They get out and they enjoy this great weather we're having, the summers. Also remember some of the things that might need to take place to do that safely. And one of my greatest concerns and risks is we've got children and kids that have been cooped up for a couple of years, and they're going to be making their way out to places like the rivers and lakes and so forth, and without some of the necessary safety precautions like swim lessons. And so I'm always looking at compounding hazards. I'm always looking at, for fires, we have this saying called floods follow fires, where a lot of the erosion control, it gets burned up, and then the next time it rains, it's turned into a mudslide. And what I don't want is the issues and the problems from the pandemic to carry over to create other tragedies that we may not see or that aren't on kind of quick on people's mind. There's going to be a lot of social situations that we need to overcome, a lot of relationship type circumstances. We're seeing extremely high crime rates across a lot of country or a lot of cities, upticks in crime and so forth. The workscape across the nation is going to be changed. Some would argue it may be forever changed. Entire industries have been kind of flipped upside down, and how that's going to look going back. So much hope to getting back to what's called normal may not actually come to fruition, and we might absolutely be operating in a new normal where things that existed back in 2019 or early 2020 are never quite the same. Entire work industries and how folks operate, that could be forever changed. So just I would say be hopeful, be excited to get back out, visit family, enjoy yourselves getting out into whether it's a trip to Disneyland now that that's opening back up and so forth, or whatever it may be, catching a ball game. but be mindful that things may not look completely the same, and just have a little bit of cautionary approach to stuff, especially when skills and proficiencies might be atrophied. And I would hate to follow up this reopening with the some sort of record in drowning deaths from children because they didn't have the skills that they needed to go out and enjoy the summer. So that's kind of what I've got.
Thank you so much, Daniel. Thank you for sharing that with us. Murdo?
Yep. So as a technologist, I see opportunities every time there is a crisis, right? So there is always an opportunity, and COVID brings a new set of opportunity for as a technologist to better serve the community. Government sector usually is a little slow in adopting technology. So, but what this crisis has done is embrace a lot of tele everything, like from working from home, healthcare, education. We have council meetings happening in electronically now. So that brings a lot of opportunity. So my hope for the path is we continue on the same path on adopting more technology to better serve the community. Instead of, like I said at the beginning, it's instead of reactive, we become more proactive in providing that service and support and things like that. So in the technology area, they call a smarter city. So Sacramento become a leader in that airspace, becoming more smarter in connectivities, collaboration, and innovation. And just like here, like partner with internal departments and also the external partners. So city do more partnership to innovate. So my hope is actually city is in the right path, and it's been in the right path. So we continue on that same path on innovation side and having a better managed, better collaborated city and a model for every other city around us.
That's awesome. Yeah. Thank you so much, Myrtle. Thank you so much for that. And I will say on Team D8, Team Heart and Hustle, we'll be working closely with IT because I know my team loves to innovate and want to be able to get information out quickly and using all of the mediums that are available to us. So thank you so much. Steve, what is your hope for Sacramento residents post-pandemic?
Well, I just can't wait for post-pandemic because we want to see all the faces that frequented our center every day. Yeah. They're kind of like family to us and we miss them. I know my front counter staff talk all the time about they can't wait to see those smiling faces walking through the door again and catch up with them. But when people actually come back, the residents will see a lot of new upgrades and updated features at the center.
Nice.
We've had a new multi-purpose room floor installed. Our computer lab is being upgraded so we could host classes like resume writing, coding, working on digital art graphic classes also. Our teens will be surprised with 3D printing, digital DJ spinning, and a variety of clubs. Our arts and crafts room will actually reopen with a new kiln and some new embroidery machines. And we also upgraded our conference room with state-of-the-art technology. So basically, I'm just saying the staff is ready. So basically, let's get our vaccines and open up the center again so we can see everyone again.
Awesome. Thank you so much, Steve. Katie?
Yeah, I think Steve covered it pretty well, right? We in Youth Parks and Community Enrichment, our goal is to create a quality of life for our residents, right? Where we're creating thriving neighborhoods, where people are healthy and they're engaged and they're socializing with their neighbors. And to Daniel's point, right? We have seen these gaps where people have been isolated, and haven't had the health and wellness opportunities because the gyms have been closed and exercise classes have been closed. And so we're really excited, even though things are going to look a little bit different, just to make sure everyone continues to be safe. We're really excited to continue and just bring back that quality of life and that enjoyment in life, because a lot of us have just been day to day, rightfully so, right? It's just on a day-to-day basis that we're here, but trying to move past that in a post-pandemic life and really lean into our community centers and our parks as a way to create that sense of normalcy.
Awesome. Thank you so much, Katie. Dr. Oshida, you're the last person, then I'll close it out. What is your hope for our Sacramento residents post-pandemic?
Well, I think for me, when I hear the word hope, what comes to mind in a jerk fashion is that hope really is an intersection of thoughts and action. So I have hope that I'm not going to get this terrible disease somehow. I hope that I can get back out and enjoy these amazing programs. I think I want to go do that DJ program, Steve. I think I might be good at that. I do have a great playlist when you come out to our centers.
Yes.
And
Yes,
so hope is great. You know, hope is inspiring. Hope is gives us a lot of good. Keep to every person who wants a vaccine, help them get vaccinated. We will absolutely be at the Pannell Community Center this Friday. If you're on this,
I think Dr. I think. So I think Dr. Oshita is breaking in and out a little bit. Is it just me? Do you all thumbs up? Yeah, you hear it too? Okay.
Yeah, we hear this. I think it's breaking.
Yeah.
How about now? Am I back?
Yeah. Yes, you're back. Go ahead, Dr. Oshita.
Okay. But saying is so it needs a plan. And that plan and my plan is to try and help vaccinate any and all in Oak County who need to get vaccinated. If you are on this call, if you know friends that are out there, if you have not been vaccinated, come to Pannell Community Center this Friday. We will be there. We will be suited up and ready to go. If you have questions, let's sit down, let's talk, let's address those questions. We know that there are a lot out there. We know that there are a lot of questions that are out there. We're still meeting a lot of patients that have trepidation about the vaccine, who are concerned also about going outside. What does it mean, et cetera, et cetera. And to those that have already been vaccinated and that are asking themselves, what can I do to help? I ask often our volunteers every Friday to ask this question: where were you when? Where were you when that pandemic of COVID hit? Where were you when center? And what did you do? Because every Friday we live, we learn, and we live a legacy. Every patient we live, we learn, we leave a legacy. And we're going to keep going on with that. Our plan is to vaccinate, and our plan is to stay on the forefront of this. At Benchmark Research, we're actually just awarded the research, the Novavax study. This is for pediatric kids aged 12 and above. And this is just paramount. Like we keep saying, is what's affecting kids? What happens with Pfizer, Moderna? What happened with the vaccine? And so we know that we need to keep going and we need to stay vigilant. And those are the studies that are out there that we see at our clinics to continue to test, we have surveillance, and we have an understanding of this disease, not just around it, but maybe get in front of this disease. And to do that, we have to do it proactively, but with a dedicated plan of attack. Plan of attack in so doing is also with love and caring. When you come to our clinics, what we hope is that we can break down those barriers. What we plan for is to break down those barriers, to have these conversations, to sit down, to pass out food and water, and to have discussion, and to have some great music.
Yes, absolutely. Thank you so much, Dr. Oshita. Thank you so much to all of our panelists for being here today to share a little bit into the glimpse of the behind the scene of what it takes to make a people power clinic a reality in the heart of South Sac, where I would say it is needed most. With that, I just want to give a quick reminder that we are holding our vaccination clinic every Fridays from 9 to 2 this week. On Friday, we are taking walk-ins as always after 10 o'clock. So if you can't make an appointment, feel free to walk in after 10. And with that, I think that's it. Again, we will put the information on our common thread, our link to our city website, where you can actually go and register for an appointment. Again, if you can't register for an appointment, you can also just walk in at the Pannell Center. The address is 2450 Meadowview Road. And I will see all of you there every Friday out there hustling, cleaning clipboards and pens, ushering folks through the line. right? All heart and hustle. So with that, again, I just want to say thank you. If you tuned in and watched us, or if you're watching this, you're catching this after lunch or tonight, again, thank you so much for tuning in. Just really grateful. And again, shout out to Steve, Katie, Dr. Rusty Yoshida, Myrtle, Daniel, and Mac, who had to leave early. Thank you so much for your heart and hustle and everything that you do for the community. With that, I'm going to sign off, and thank you so much, everyone. Have an awesome week.